Hi everyone, I'm Marissa Dharmawardene. I'm the palliative doctor at the ALS clinic. I don't have slides today. I just wanted to chat a little bit about what palliative care is and what the role of palliative care is in the ALS clinic. So in broad terms, palliative care is care that's directed at quality of life interventions. So that can include symptom management, it can be psychosocial support for patients and families, and it can include planning for the future and medical decision making. Sometimes people worry that if palliative care is involved in their care, it means that other parts of their care will stop, and that's not the case. Palliative care is meant to run alongside the other aspects of your care and the other treatments that you're receiving from your doctors and from your multidisciplinary healthcare team. When I visit with people in clinic, I often spend a lot of time talking about symptom issues and how they're feeling from that perspective. I ask people about how things are going at home, whether they have the supports they need, if they're having issues navigating the home care system, which can be challenging for a lot of folks. And then the third part of my work is around medical decision making and advanced care planning. So I said that I didn't bring any slides today, but I did bring kind of a prop. I just wanted to show people this green sleeve. Some of you may have seen it before, some people might not have. This green sleeve is what I'm talking about when I say advanced care planning. And it contains information that we use to be able to think in advance with you about how you would want your medical team to direct your care if we had to make decisions quickly or if something changed quickly with your health. Sometimes those conversations can be challenging for people. Some people tell me they haven't thought about those issues before or they haven't wanted to think about it before, and that's okay too. These discussions can also be an opportunity for us to think about, sorry, my throat is really dry. It can be an opportunity for us to think about what our goals might be for ourselves in different health scenarios. It can be a chance for us to address fears that you might have. And it can also be a way for us to share those priorities and goals with your family and with your loved ones. Sometimes people ask me if I'm talking about advanced care planning because we are in the ALS clinic. And the answer to that is also no. Thanks, Leon, for the water. Thank you. So the answer to that is also no. April 16th was actually National Advanced Care Planning Day in Canada because this is an issue and a discussion that ideally we should all be engaging in. There's lots of research now that the more we are able to have these discussions openly and ideally at different points of interaction with the healthcare system, so not necessarily just in the hospital or just in the emergency room, but also in places like clinics or with our family doctors or our home care teams. Those discussions tend to be more useful for patients and families in terms of having the time and the space to really think about some of the issues behind it. So that's kind of all I had to say today. I just wanted to kind of give an overview of some of the things that you might chat about with me in the clinic and say hi, so thank you.